Palmares 2 study is an observational, real-world Italian study, retrospective and prospective, and collecting real-world data on HR-positive, HER2-negative breast cancer with advanced disease. As we all know, this hormone receptor positive HER2-negative breast cancer has changed, revolutionized the standard of care with the introduction of CDK4/6 inhibitor. But we know that not all the patients benefit the same from the treatment. As we know, in fact, there are a quota of patients, about 40%, that progressed as early progressor, as we define as progression before 18 months. Identifying this patient would be crucial to individualize treatment and for treatment escalation and treatment de-escalation. For example, the addition of oral SERD or targeted treatment, or why not switching to chemotherapy for high-risk patients. We presented data in the first data cutoff of January 2024, when 18 enrolling centers were available and 1,982 patients were enrolled in the clinical study. We applied artificial intelligence techniques, and in particular machine learning, to identify these early progressor patients, defined as progressor before 18 months from the start of CDK4/6 inhibitor. We used 52 features that were a combine of clinical features, laboratory features, biological variables, to generate a unique model able to predict the early progressors. First of all, we excluded patients with insufficient follow-up and take one of the study centers and as external validation. We then split the population in a training and test cohort. The training cohort to create the model, and the test cohort to evaluate the performance of the model in a validation cohort. About the features, we performed the features engineering, so the one-hot encoding for categorical variable and normalization scaling for continuous variable. We applied 4 types of machine learning classifiers. In particular, we used the logistic regression with the elastic net correction, the random forest as a tree-based model, the XGBoost as gradient boosting with the tree-based model, and neural networks. Our results were quite good. In fact, we obtained a performance in terms of AUC ranging from 0.70 to 0.74 in the training cohort, and in the test cohort, an AUC around 0.65. Interestingly, the performance remained high also in the external validation cohort, demonstrating the reproducibility of our model. To go in deep inside the model to understand which variables mostly influence the model, we used explainable AI techniques. In particular, we applied sharp analysis to understand which variables influence the model. And in this case, we found that the presence of little metastases, the endocrine resistance, and the expression of progesterone receptor as the most influencing variable. And this is really important because we know that these variables are the most important also as the general knowledge and available literature. So, to conclude, our results for the first time we demonstrate the applicability of artificial intelligence to identify subgroup of patients that could be targetable with additional therapy, and we want to extend the follow-up to adding even more patients, and finally adding data with different data sources like radiomics, pathomics, genomics, and transcriptomics to even improve the model, the capability of the model.